Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Um, what you might notice is that on in the screen here, you see kidneys, and you might say, well, those are kidneys. How do they impact my back? Well, hopefully you can see and appreciate in this picture the proximity of the kidneys to the back. The kidneys are aligned right tucked underneath both sides of your back, underneath where your ribs are. And unfortunately, what can happen a lot is that if you don't have good kidney health, you can get what's called referred pain to your back. Also, if you don't have good kidney health, it impacts the blood flow and the filtration of the blood, which then in turn can impact your spine health. So the two, even though they are separate organs and organs have separate functions, they are closely associated hand in hand because of their individual functions. The back is important for maintaining the stability and the scaffolding and the upright posture so that the kidneys and the blood vessels can have the appropriate room and space in your body to do what they need to do. So the kidneys and the back are close hand in hand. Another important linkage that they share is blood. Blood in the sense of having enough volume and having appropriate concentrations of the minerals and the supplies in the blood, and just having proper hydration. So this lecture is going to kind of weave in and out between the kidneys, between blood, between the back, and proper hydration, because it's an overall wellness discussion of keeping yourself, one, healthy, two, targeting your back, making sure you've got good posture and not having back pain, but also realizing that, hey, I'm having this back pain, but there may be something else at play. So we'll just kind of go through this, but hopefully in this picture you can appreciate there's sort of a ghosted picture of the spine here, and then alongside there are the kidneys, and you can also see the blood vessels associated with the kidneys. There's blood vessels associated with the spine. We'll get to that in a minute. But important to note is I talked about referred pain. And what I mean by referred pain is that the origin of the pain is not directly from the place you feel the pain. It's referred from a different source. And the referral source in this case is the kidneys. So the kidneys, whether it's a huge kidney stone or there's some kind of local swelling around the kidneys or an infection or something that's triggering the kidneys to be inflamed, and through your nervous system is referring pain to your back. So that's what this picture here is illustrating, that something in the kidneys, and actually this cartoonish drawing down here is showing that there's something locally inflaming the kidneys, causing this person to have referred pain. So having pain, typically it's not in the very low back. When you have referred kidney pain, it may be a little bit higher towards the mid back, but it would probably be more central, maybe a little bit to one side based on which kidney is inflamed or damaged, but it should be a little bit higher in the back. So hopefully in this picture you can appreciate that it's more mid back region and not necessarily low back. But hopefully you can understand that this person, they may be just having, like over the past few days, increasing soreness and pain to the middle of their back, and that it may not actually be their back in turn, but it's something else deep inside in the organs, particularly the kidneys. So that's something to monitor, that if you're having just a sudden or over the past few days an increase in back pain that doesn't seem to have a source, you may want to consult your doctor, whether you call your doctor or go get checked out, because You don't want to let something like this linger because it can have other side effects to your body, and you don't want to have an infection or something else happen. Uh, but yes, so the kidneys are the actual source of the back pain, not the spine here. But it can mimic similar pain that you would have with a mid-back problem. So just something to be aware of. When we talk about the kidneys, you have to talk about blood vessels. Because the kidneys, their essential job is filtering and removing of waste products or excess products from the bloodstream so that your bloodstream can have a healthy concentration of the minerals and the metabolites and everything that it needs to keep the body going. But also, if there's excess or there's waste products, those waste products are excreted through the kidneys. So your kidneys have to work properly. The reason I'm talking about your blood vessels and your kidneys is because your spine, both your bone and the associated structures in your spine, your nervous system, the spinal cord, where all your nerves travel through, and the disc and everything need a healthy blood supply to maintain good body health, good structure, good bone density. You have to have good, adequate blood supply. So if your kidneys are not working properly, in turn, your spine may not have the appropriate health and structure that it needs to be strong, and you may be at risk for a fracture. So this picture is just a general layout. As you can see, there are closely associated blood vessels, arteries, arterioles, and little capillaries that feed the bone tissue. Bone is hard, bone is dense, but it does have a blood vessel traveling to it. There are individual cells within the structure of the bones that need healthy nutrients to operate, allowing for proper calcium deposits and other minerals, and just maintaining good bone health. So if you don't have good kidney function and you don't have good blood, you don't have good blood supply or blood health, then you're not going to have good bone health. And in turn, you're at risk for a fracture. There are times when people don't even fall and they just have a bone fracture just because their bone doesn't have good density. So that's just something to be conscious of, making sure you've got good hydration, good kidney health, just to be sure that your bones can survive. So as you can see, both the hard bone, the actual bone structure, and the discs supplied are supplied by these blood vessels to maintain good health, good volume so that they can support the spine. But also, and you can't really see it here because this picture is small, inside your spine, there's a hollow, well, it's not hollow, it's filled, but there's a tube where your spinal cord, the nervous system tissue, travels. This is very important because these are your senses, such as your touch, pressure feeling, everything, but also your motor actions traveling to all your muscles and your organs to supply. So typically in the front, if you think of front and back, in the front, there's more of the motor supply, and in the back, there's more of the sensory side. But as you can see, there is a very, very close associated blood supply. And if this blood supply is damaged or interrupted for some reason, this nervous system tissue is very, very sensitive, and it can almost immediately have a response that can be from numbness to tingling to actual pain, to loss of function like motor function to your muscles. So having good kidney health and good hydration is essential, not only for your body health, but for your bone health and your muscle health. And if you don't have a good structure to your spine, you're not going to have enough support to allow for these soft nervous tissue structures to operate properly, and they're going to get pressed on, leading to pain and leading to loss of function and some sensory issues. So having good kidney health, having proper hydration is essential. Let's talk about hydration for a second. Sorry. It's hard to give an adequate indication of how much is proper hydration, because people vary. People have different activity levels. Men have different dietary needs versus women. Um, but a good thought process is trying to frequently throughout the day drink cups of water. That's this when I talk with my patients about hydration. I really try to tell them, hey, once an hour or so, at least you're during your waking hours, try to drink a cup of water. Just try to keep a good supply so you can keep good blood volume, but also so your blood volume can have enough pressure and have enough flow so it can travel through your kidneys and allow your kidneys to operate efficiently. By having enough volume and having enough flow to your kidneys, you can in turn help reduce some of this swelling and inflammation, then in turn reducing the pain you might have from kidney pain, because the system is operating more efficiently. So again, even though you may have you may have good blood pressure, you may have good bone density, there may be just something else like your kidneys are not working as efficiently that could be leading to the back pain. You didn't have an injury, but you're having this strange onset of mid back pain. So just try to be aware of that, thinking consciously about keeping proper hydration. Again, what I usually tell my patients in physical therapy when I'm talking about hydration is, every hour during your waking hours, try to drink a cup of water. Just try to keep a good pattern. Keeping a good pattern is probably the key takeaway from that. But the important thing for this lecture is that there can be sources of pain in your back that are not necessarily from your back, and they're referred from other sources. For example, today's topic is about the kidneys and how the kidney health can refer pain to the back and mimic what seems like back pain. So that's all for today. Just a little bit different topic, trying to interwork total body health, proper hydration, and signs of pain, and strategies to reduce pain if they start occurring, particularly in the mid back region. Again, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.